Mostly the biggest thing was the bloating. You always felt full, almost like as if someone was slightly sitting on your stomach. I would have to urinate a lot, I knew when I went into town, I knew where all the bathrooms were. A little bit of pressure in my lower area, my pelvic area, that would get worse during my cycles. More of a pinching, stabbing pain. I'd be so dizzy and weak, I would just have to stop and lay down.
For 3 years, Linda Murphy suffered through increased bleeding and pain that made the little things in life difficult to bear. Acupuncture provided some relief, but when the treatment stopped, the symptoms rushed back.
One afternoon during my cycles, I said to my husband, tears were coming out. I said, I'm done. I'm not living. I'm not happy. I can't handle this anymore.
Linda's gynecologist recommended a hysterectomy. But Linda was afraid a major operation would interfere with her life's passion.
I horseback ride. Very active. I do a lot of yard work, and I was concerned about any kind of incisions.
That's when Linda was referred to Beth Israel Deaconess Medical Center in Boston and Dr. Hei Chung-her, a specialist in minimally invasive gynecologic surgery.
What we learned quickly was that on exam, she had a very large, sizable fibroid, a cavitary fibroid called submucosal fibroid, that was prolapsing through her cervix. It was trying to abort out the cervical canal and exit, so it was trying to make an escape.
Fibroids, or smooth muscle tumors of the uterus, are actually quite common, with some estimates suggesting that 3/4 of women of childbearing age may have them. Most may never even know it.
Small fibroids in particular, depending on the location of growth, can be asymptomatic. So they can be there for years and women may not know about them. But when they grow to a certain size or an unfortunate location, they can become symptomatic.
Linda's uterus had several fibroids. However, the fibroid in her uterine cavity had grown to the size of an orange and was believed to be the one causing her really heavy bleeding. Given her severe symptoms, Linda was shocked when Dr. Herr told her she may not need to have her uterus removed. It was possible she could avoid a hysterectomy.
She told me there on the spot, I think I can fix you. She said, she examined me and said, I see 99.5% of your problem. And I had been living with it for so long, I almost didn't believe it.
In fact, Linda had her fibroid removed without any incisions at all, through a 30-minute procedure called hysteroscopic myomectomy.
The little camera can go through an incisionless route through the vagina, through the cervix into the uterine cavity. It's same-day surgery, so the patient checks into the hospital, is able to go home the same day.
Dr. Herr notes there are many options for women with fibroids these days. These include oral medications such as hormone treatments. The Mirena JUD, a contraceptive device that thins the lining of the uterus to slow bleeding. Uterine Embolization, a technique which cuts off the blood supply to the uterus. And Endometrial Ablation, a procedure to destroy the lining of the uterus. But she notes it's important for women to seek care early on, before symptoms become unmanageable.
When you present very symptomatic, either with low blood counts from severe anemia, or if you have such severe pain that you don't have months to trial conservative medical options, it diminishes your opportunity or range of opportunity for treatment courses. So that would be the one thing I would urge patients, is to feel the opportunity to seek care early so that you can be educated about your treatment courses.
Linda is back in the saddle again, looking forward to competing and enjoying life. Her only regret? Not getting help earlier.
I think I wasted a lot of time, is what I did. And I lost a lot of time. So it's not fair, but I was scared, and I think a lot of women are, and it's like I'm catching up. My husband now says, sit down because I'm doing too much. He says, well, you go sit down. So it's nice.